Bismillahirrahmanirrahim. Uh, Today, I will be talking on the topic, can people with CKD and diabetes fast during Ramadan? Before starting my lecture, I would like to thank Professor Hasnan that he has given me this opportunity to talk on this very important subject related to diabetes, Ramadan, and CKD. So there are limited studies available. There are not much of randomized controlled trials on this subject. And due to the obligatory nature of Ramadan, all published studies on Ramadan fasting by their nature are non-intervention and observational. Most of the studies are small scale and performed at a single center, and only few studies have non-fasting control group. So we have limited studies and we don't have much of the prospective studies. And that's why we often take this group of patients as high risk patients, because previously we used to have categories of risk assessment, and we used to have category with high risk group, very high risk group, moderate to low risk group. And these people with CKD are considered with chronic stages 4 and 5, they are considered as very high risk group. While the CKD stage 3 are taken as high risk group. So they were considered when we were using these categories in very high risk and high risk categories. Then we had this risk score recently introduced in the guidelines, which is based on experts' opinion. Similarly, as the categorization was on experts' opinion, this risk score is also based on grade C and D evidence for stratification of people who fast during Ramadan. So these renal complications are given high scores if they have a eGFR of less than 30 mils per minute. They were given 6.5, and below that 4, 2, and 0 with increasing eGFRs. So these are considered as getting high scoring points when somebody has CKD as an element for risk assessment. So we designed a study to check the clinical validity, which was the purpose of this study, to look into the validity of this score in people among who are fasting during Ramadan. The rate of complication was although low, and the majority of the study population fasted safely. But we found in this study also that looking into the factors and the risk elements, what were the significant risk elements which have given complications to patients who fast during Ramadan, and found that chronic kidney conditions, these are significant risk factors for getting hypo and hyperglycemic complications during Ramadan. Another study which we have looked into people who fast during Ramadan with normal kidney functions, and looking into their profile longitudinally at 6 weeks, 3 months, and a year after. And we found that most of the patients during the first 6 weeks, people with normal kidney function, they have dropped their eGFRs significantly at 6 weeks' time. But those who follow at 3 months' time, most of them recover almost completely, and at 1 year time, they almost recover to their normal baseline values. So people with diabetes, if they have normal renal function before Ramadan, during Ramadan, a dip is there soon after Ramadan, and then there is a gradual improvement in their renal functions over a period of 1 year. Another study in which we have looked into this case control study, where we compared people with diabetes and people without diabetes, looking into the creatinine and eGFRs of these people, comparing the two groups. And we found that the eGFR remained the same in very little number of patients, but increases in some number of patients, and it decreases in another number of group of patients. So there was a mixed picture where you get some people get increase in eGFR, some people got decrease in eGFR, and um, overall there was an improvement in eGFR. There was no problems with the decline of renal functions during Ramadan. Then another global survey which we did with the DAR Alliance, and this was looking into several factors, comorbidities and other factors related to Ramadan and diabetes, and looking further into the people with CKD in this survey, and we found that people with CKD, they have more hypoglycemic complications, significantly more ER visits, more hospital admissions as compared to non-CKD cohort. And also with hyperglycemia, there were more people presenting with hyperglycemia than people without CKD. So this was a survey which was published. And then we did last year and 2 years before, and then taking into the looking into the clinical profile of these patients who fast with CKD in both the surveys 2020 and 2022, and taking into all together, looking into the characteristics of those patients. And these characteristics were compared between the group who had CKD and those who didn't had CKD. And then with the age-matched and sex-matched comparison between the two, and we found that people with CKD have more duration of diabetes, that people had a prolonged duration of diabetes as compared to people without CKD. And they have more poor glycemic control as compared to people without CKD. There were more people who were obese. There were more people who were hypertensive in CKD cohort. There were more people on insulin. There were more people with microvascular complications. Sorry. And regarding the fasting status of this study population, we found that there was not significant differences between the CKD cohort and the control cohort. Not many had almost both of the groups had fasted for almost most of the Ramadan period, and there was not much difference. Even some patients in CKD cohort also fasted during the month of Shawwal. Regarding hypo and hyperglycemia, while fasting, we found that it was more in CKD cohort hypoglycemic episodes, but not the hyperglycemic episodes. Hypoglycemia was more common in people with CKD. Regarding emergency department visits, hospital admission, breaking of fast during hypo and hyperglycemia, there were emergency department visits, not much difference, although there were more in people without CKD. But regarding breaking of fast, due to hypoglycemia and hyperglycemia, there were more in CKD cohort. And similarly, the hospital admission because of hypo and hyperglycemia were more in CKD cohort. So comparing the two groups, CKD and without CKD, we found that most of the complications are occurring significantly among patients who had CKD. And looking into their diabetes management, we found that although they received education, the people with CKD received education more than the people without CKD. But again, not all of the patients received education before Ramadan. And the frequency of monitoring was also not so much difference between the two cohorts. So in conclusion, we found this that people with diabetic kidney disease not only have diabetic kidney disease, but they have multiple comorbidities, like they have hypertension, they have poor glycemic control, they are obese, they have longer duration of diabetes, they have many uh, complications, microvascular complication, and majority of patients were on insulin. So again, as these surveys were retrospective surveys, and we don't know whether, as we know that there is most of them have received education, but many of them have not received education, and many of them didn't get their dose adjustment. So we don't know people, although they were on insulin, but were the doses were adjusted during Ramadan or not. Uh, this is not clear. So, and these people, uh, as from these two surveys, we found that not only they are getting complications as well. In both the surveys, the conclusion is that the people with CKD have more complications, hypoglycemia and hyperglycemia. So it is recommended that early assessment of these patients, we can use a risk score for early screening, and then identify people with higher scores. We can educate them if they want to fast safely. They have to be educated, giving them structured education, as we have concluded from these surveys that not all people received education, and without education, we expect to have complications. Also, these people had more comorbidities, and that's why they have to look. We have to control their blood pressures, their poor glycemic control. They should be on proper management of diabetes. They should be given dietary advice. They should be asked to monitor the sugars very frequently during Ramadan, as they were not as much checking the sugars during Ramadan. Both of the groups, like people with CKD and people without CKD, the monitoring frequency was very minimal. So the structured education is the advisable thing to do before Ramadan, and screening them early. These people can fast, but with some risk of hypo and hyperglycemia, and these risks must be explained to these patients before Ramadan in their pre-Ramadan visit, uh, by calculating the risk score, and then if they have higher risk score, they should be told about the risk, and then they have to be educated if they want to fast about the structured education. And although these are retrospective studies and they are showing some associations, but we need several prospective, multi-center, multinational studies to see what is the actual risk of fasting in people who fast during Ramadan with CKD. I thank you for your attention.